parliament. But we have incidents in few counties. And you have heard many times the president talking about it, where county Ruto, it has never happened. And this is where, and I think this is where Senate will help me, because the Senate oversights counties. Senate oversight counties. The Senate Health Committee should go and do a report and identify. And we are ready to give you. There are 2-3 counties we have found out, and we have told them, and what they are doing is criminal. It's criminal, it's against the law that you have passed. To Honorable Kalwale, I don't know whether it was you. The maternal mortality figures you are giving for Kiambu County is not correct. Yes, it's wrong, and I think it's good you withdraw it. And I am ready to provide. There are many mothers who died, particularly when doctors were on strike. I have the names of the patients, of the mothers, and I have the names of the newborns. I think for record purpose, before the strike, they were doing well. I agree with you. Kiambu was doing well. But as a Minister for Health, I want to confirm to the nation that I agree with the union, with the doctors, that a number of maternal deaths occurred. And I'm ready to provide that evidence. So please, I don't want Governor Wamatangi to hear that and then says I heard it from the Senate. That information is not factual. Senator Nambwere, I think for the first time the anti-D is an injection. I think the doctors like Dr. Kalwale can explain. Is now for the first time is covered under SHA. This is one that helps in the spilling of blood. So this is a more comprehensive now, which is found in the Linda Jami than the Linda Mama, and the reimbursement for that injection alone by SHA is 6,000. The senator for Nyandarua, Your Excellency, I think he has left. And it's not good, Your Speaker, that you ask a question and then you are not around. When I was, it's not, because you know what was the purpose of asking. But because I'm going on record and the senators are listening to me and the Speaker, let me answer. I think it's good to listen. Anyway, I've done it. It's okay. That his question was policy, and I want to tell him that policy does not allow definition of any patients, including mothers and newborns, in all our health facilities. And we really want him to report to us any such facilities for appropriate. We want the leaders to report to us. And we have a package. Tariffs are better by 3 times the tariffs provided and benefits provided by President Ruto's government. Is far much better than the one of the old government. And why do I say so? I mean, from 2,500 to 10,000 for normal delivery, 17,000 to 30,000 for cesarean section. That alone tells you, in terms of investment alone, is a big difference. And it's a very comprehensive complementary package. And it does not wait for a budget to be allocated. It is not a victim of supplementary reallocations. It is there. Secondly, the 400,000 teenage mothers in our country are fully covered. They just need to walk to any health center with their birth certificate or with their parents' ID, special ID, a temporary ID for all our teenage mothers. We don't want to encourage that. The Linda Jami covers the whole family. It doesn't cover only the mother. Linda Mama was covering only the mother. This one is covering the child, even after they leave, so this is a more comprehensive. Linda Jami now covers, Linda Jami, Mr. Speaker, covers 28,000 per day. This was not present under Linda Mama. And I really want members to get to the package. Linda Jami now covers anti-D, as the Honorable Senator Nabwere have asked. Linda Mama never used to cover that. I can talk the whole day if you ask me to compare Linda Mama and Linda Jami. It's world apart. It's like first world, third world, and first world. So I think we must thank. Prevention of teenage mothers, advocacy, we must do a lot of advocacy. A lot of advocacy with our community leaders, with our church leaders. I think it's a responsibility for all of us. We should not promote it, but we have no choice. They are our children, but we must see how we can reduce it. We must ensure our girls enroll in schools and they stay in schools. That is one way we can. We must make sure that school health programs to teach girls and boys about changes of their parental, premarital sex is part of our curriculum. We must have peer-to-peer support for all adolescents. Honorable Speaker, I don't know whether I have left. There was a question by the senator for Muranga, and I have read the law. I'm coming to the honorable senator for Tharaka. Cabinet secretaries by law, we are politicians and we will politic. And I want him to read the Conflict of Interest. I want him to read the Conflict of Interest Act, which was passed, which amended the Leadership Act. Anybody else in the public service cannot do politics. But CSS, the law allows me, and I've tweeted it, and Honorable for Muranga, you have to live with me. I serve a political government, and the law allows me. If you change the law and says ministers should not politic, I will not politic. But for today and going forward, I abide by the law. I'm going to do politics. You know, I agree. He says.
Order, honorable senators. You've already responded to that,
yes.
honorable.
The last one is on the senator for Tharaka Nithi, the great county where our very able and intelligent deputy president do comparison. I have a lot of respect for the former deputy president, but I'm just talking about the current deputy president senator. Those Kenyans who cannot pay is a very good question. Before NHIF was a club, the former NHIF, only 1.8 Kenyans in the informal sector have registered. Today I want to report in barely 1 year, because we are about to celebrate 1 year of SHA, over close to 1 million Kenyans in the informal sector have registered SHA. How do they do? There are those who can, they go through the mean testing and they get the amount and they pay. And there are those who can pay. That's why we introduced SHA Lipa Pole Pole. And I want to tell the House, since we introduced SHA Lipa Pole Pole, we have collected over 650 million shillings, where Kenyans go through that. They pay 4 months. The other 8 months, they pay through SHA Lipa Pole Pole, either daily, weekly, monthly. And Kenyans have embraced. As of last night, the figures we got, over 2,000 Kenyans went through the mean testing and paid and through the SHA Lipa Pole Pole. So it's growing. The budget itself and the senators and the speaker are paying more so that the lady in the market, the boda, the people at the lower level of the society can pay less. They can pay 500, they can pay 600 per month, totaling about. There are even those who pay up to 3,600 annually. So, Mr. Speaker, I think I have answered all the questions. Yeah, foreigners, I agree with you. Number one, have alien cards. Foreigners have different immigration documents. They can use those documents to pay for SHA. The the United Nations High Commission for Refugees, have signed an MOU with the SHA, and they have brought their people on board, all the refugees, to join SHA. So alien cards are allowed. They can go walk in and pay cash. They don't need to go through the system. And they can use any of the documents, because they must be using a document to stay in our country. They cannot just be in our country without a document. So the document that they will use can be valid for SHA registration. But the one you have seen, Honorable, my neighbor, Senator through Tana River, is the one that is only meant for the people of Kenya.
Honorable Senators, we shall now move to question number 117 by the Senator for Kisumu County.